Well, thank you for the introduction and opportunity to present to the audience today. And as mentioned, we're going to talk through and still on the concept of FADs, foreign animal diseases, but also a lot of these concepts related to feed and feed biosecurity are very applicable to some of our endemic pathogens that we deal with on a routine basis as well. And here's just some of those examples. We've thought about bacteria within the feed supply for quite some time, particularly on the poultry side, salmonella, other bacterial pathogens we've been aware of within ingredients or the feed supply. However, on swine, particularly with viruses, this is a much newer area of research. A lot of research is focused on PED over the past decade, and over the past few years, with the wide expansion of ASF globally, a lot of work is focused on ASF and the role that feed or feed ingredients may have in the potential dissemination of that very devastating disease as well. So when breaking down feed biosecurity and understanding a very complex feed supply, I like to break it down into two categories. There's a prevention component. How do we avoid that ingredient or that feed from becoming contaminated with the pathogen in the first place? And then there's intervention. What do we do if it does end up there? What can we do to reduce the risk or the likelihood of that contaminated material causing infection? And really these are our two components. We can describe them as hurdles. We implement ingredient sourcing, understand where things come from. We implement biosecurity practices to prevent that contamination from occurring. And then we can add additional hurdles if we would be interested in doing so. And many of these are point-in-time strategies or residual approaches that we'll talk a little bit more about what I mean specifically with those. But the concept being biosecurity is not just one single practice. It's a series of hurdles, or I heard the analogy a couple weeks ago of a Swiss cheese model, that if you take one slice of Swiss cheese, there is a likelihood that you can pass through without smacking into some cheese. However, if you layer multiple layers of Swiss cheese together, the likelihood of getting through that material without coming into contact with cheese is really lower. I think about feed safety in that manner. There's a lot of practices that have been investigated individually, but really the success of a biosecurity program is the combination of multiple of these practices. So to begin with, I think it's really important to focus on the prevention point. That is our first line of defense. And really that involves where do our different ingredients come from. Non-bulk ingredients, so bags or 1 metric ton totes, it's fairly easy to understand the dynamic within where those come from and how they're processed. It gets a lot more complicated with bulk ingredients. But really, when understanding those raw materials coming into the feed mill, we need to understand the biosecurity during manufacture and packaging, storage, as well as the transportation of those products to us as the end user. And really within that, a lot of research recently is focused on the role of people, trucks, and other fomites. Obviously, bacteria and viruses don't have legs. We as people do. And that allows us to move around in our different activities on a daily basis, particularly PD and ASF within feed mills. People are some of the most common ways that we could spread those pathogens around the feed supply. And this is an area that, in the area of prevention, and the biosecurity associated with avoiding that contamination occurring has had tremendous improvement in not only the quality of the research being generated over the last number of years, but also the implementation of that as an industry. So our first line of defense in feed biosecurity is preventing that contamination from occurring. Then the next layer is intervention. What can we do if a pathogen unintentionally gets inoculated or contaminated into our material? What can we do about it? So there are two classes here that I think of. Point-in-time strategies, that's the common holding times or thermal processing, pelleting, or residual approaches. And point-in-time, at that point in which that process is carried out, would be expected to have some level of viral inactivation. However, there's no residual effect. If subsequent recontamination were to occur, that product or that ingredient is fully susceptible to that recontamination, that thus being a point-in-time strategy. However, residual approaches would be expected to have some sort of activity after that, and their commonly feed additives are added to that ingredient or added to that feed. We would expect that they would have some potential to avoid recontamination after that initial point of manufacture. there's a number of different compounds and commercially available feed additives in this space, and it's really pretty complex from a producer standpoint to understand what to do. So our team at K-State put together a list of some commercially available products, tried to summarize the data available, put it in all one resource, speaking the same language. We try to update this over time as new data and new products become available. But this is our approach to try to describe what some of those residual strategies are available to swine producers. So that's some of the science and how we focus on the prevention as well as intervention techniques. Next, I'm going to spend a few minutes talking about the U.S. SHIP program, the Swine Health Improvement Plan. And there will be some more later in this morning's presentation, a little bit more the background of the program. But I'm going to talk specifically about how feed biosecurity is incorporated within the U.S. SHIP program. So fundamentally, the program has several different key areas focused on sampling and testing, traceability, as well as biosecurity. And within this biosecurity bucket, we have a working group over the past couple of years that have focused specifically on feed biosecurity. So the first House of Delegates meeting for the U.S. SHIP program was in the fall of 2021, and outcomes of that initial House of Delegates meeting was a program standard that focused on the feeding of swill, garbage, or table waste, and that would not be permitted for participants under the U.S. SHIP program, as well as a resolution. And that resolution essentially stated the House of Delegates sees this as an important area and wanted to continue work going down this area of feed biosafety. So that's what we did. So over the last year, our working group has been about 30 to 35 members, and we tried to get a broad array of a wide number of stakeholders, representing producers, veterinarians, nutritionists, getting representation from the feed industry and ingredient suppliers, trade associations and allied industry, as well as our regulatory partners with representation from USDA and FDA. So in this, we had about 30, 35 different participants for our meetings to get a wide array or a wide background of perspectives as it relates to feed biosecurity within the scope of the U.S. SHIP program. So an important part of that, and we'll just get into a little bit of the data and our learning through that process, we wanted to get some background information or get the perspective of those participants within the working group. So we distributed a series of surveys throughout the process, and one of the questions here was asking those that were involved with feeding pigs, do you import non-bulk ingredients from ASF or CSF affected countries into the U.S.? And this term non-bulk is a little bit ambiguous, but what we mean by that is anything packaged in 1 ton quantities or less. So 50-pound bags, 1-ton poly totes, basically non-bulk ingredients. So of the 8 responses for this question, all 8 of those imported these products from ASF or CSF affected countries. And that's not surprising with the way that our feed supply works. But what was really interesting and we found particularly eye-opening was many of these different producers implement some form of holding times, but the degree in which they implement that practice is highly variable. Here to the left, the holding time from 30 to 45 to 60 days, so highly variable in the duration of time, but also highly variable. And what's the point in time in which that clock starts ticking? Is it when it leaves the port, when it arrives here in the U.S. at a port, or when it comes into your possession? We see all different approaches taken when determining that time. And then even more highly variable is what's the temperature at that time. We know there is a time-temperature relationship for different ingredients, and we see a high degree of variation in terms of the temperatures in which these ingredients are stored. So it's good to see producers thinking about this and trying to be proactive in implementing some of these protective measures, but there's a high degree of variation in how they're actually implemented. Similarly, we also wanted to understand bulk ingredients a little bit more. So this question focused on, do you import bulk ingredients, again, from those ASF or CSF affected countries? 3 said yes, 9 said no, and 11 were unknown. And I would imagine if we really dig down into it, that yes answer probably would be quite a bit higher. A lot of those unknowns, I would imagine, probably do, and likely not knowingly, because those products from ASF or CSF affected countries do make their way here into the United States. So there, 3 knowingly imported those products. And of those 3, all of them reported doing some form of extended holding time of those bulk ingredients, 30 days or 60 days, but again, a high degree of variation in terms of when that time starts, as well as the storage temperature. So all of that was really intriguing information and brought us to the House of Delegates meeting this fall in 2022. So the working group put together a couple resolutions, basically continuing this area of work related to feed biosafety within the U.S. SHIP program, as well as taking some of the concepts of how do we take ingredients from ASF or CSF affected countries, how do we safely bring them into the United States? How do we take some of the variability in how that process is implemented, come up with best practices, and how do we scale that up through a pilot program for the industry? And also an outcome of the House of Delegates meeting this fall was a follow-up program standard, which focused on, in the event of an ASF or CSF, if it were to be detected here in the United States, there would be some temporary feeding modifications as it relates to feeding porcine-based ingredients back to pigs. Essentially, there would be some enhanced biosecurity practices we would want to include as an industry. So what have we learned in this area of feed and feed biosecurity? A lot of great data continues to be generated from a scientific standpoint, but now our challenge becomes how do we implement that knowledge and all move in the same direction to implement improvement as an industry. And I've been very optimistic about the interest and how willing folks are to have these discussions of how to move forward. And I see the U.S. SHIP program as a terrific opportunity. Producer-driven organization that's a mix of state associations, federal partners, and our producers, all having an open discussion on how we move forward. And I see the feed biosecurity as an important component of that. So we're excited about that process continuing and making improvements as an industry. So with that, I'd like to thank you very much again for the opportunity to discuss this morning. Happy to answer any questions later in this morning's session. Thank you very much.